East Asian countries have embraced wearing masks to fight COVID-19. Why has the US dragged its feet? Hong Kong, the United States has done an about-face on advising people to wear masks in public in the past week. At the beginning of the outbreak, the Centers for Disease Control and Prevention and health officials sent a clear message: masks should be reserved for healthcare workers. Seriously, people, stop buying masks. U.S. Surgeon General Jerome M. Adams tweeted back in February. They are not effective in preventing general public from catching #coronavirus, but if healthcare providers can't get them to care for sick patients, it puts them and our communities at risk. But now, after evidence that asymptomatic people can spread the disease, the CDC is recommending that all Americans wear masks when out in public to help prevent the spread of the coronavirus. And while the CDC now recommends Americans wear masks, they recommend only cloth coverings, or homemade masks, and ask that medical-grade masks still be reserved for healthcare professionals. The move is a win for those who have been publicly questioning the government's guidance and edges the U.S. closer to the practices of East Asian countries where masks are commonplace. But the U.S. is not alone in its reluctance to recommend the widespread use of masks. The WHO is standing its ground in saying that masks won't help prevent the spread of disease. Though, notably, it said that countries where cleaning and physical distancing are difficult could consider widespread mask wearing. The science of infection hasn't changed, but experts point to a better understanding of how the coronavirus spreads as the reason for the shift. Since some people are asymptomatic and could still be infecting others without knowing they have the disease, experts say it is prudent for everyone to wear a mask. This is similar practice to what has long occurred in East Asia, where people wear masks to avoid spreading illness or to ward off pollution. Throughout the coronavirus pandemic, a majority of people there have been donning masks whenever they go out in public. I've been wearing a mask since the outbreak started, says Oi Ling Lam, a finance worker in Hong Kong. It's normal for us to wear masks here whenever we are sick, even if we just have a slight cold, we still wear masks. We don't want to spread the infection to others. Lam says previous outbreaks, such as severe acute respiratory syndrome, better known as SARS, which spread like wildfire in Hong Kong in 2003, have made people more inclined to take whatever measures they can to protect themselves. We learned many lessons from SARS. I wore a mask during that outbreak and I am wearing a mask in this one. Even if the government or health experts didn't recommend it, I would still wear a mask. I won't take any chances. Mitsutoshi Hori, a sociology professor at Shumei University in Japan now working in the United Kingdom, explains the East Asian way of thinking: anyone can be carrying the virus, even without symptoms, so everyone should wear a mask. Also, he says, in densely populated areas, of which there are many in Asia, a person might be in contact with someone who is carrying the virus on public transportation or even in the house. Hori also thinks that different cultural norms have been a factor in shaping attitudes toward mask wearing. In the West, if you cover part of your face, people think you're a bit weird or suspicious, Hori says. Because of that culture, people prefer to read scientific evidence which goes against mask wearing. But in Japan, for example, mask wearing is so common and they trust it, so they look at the scientific evidence that justifies the wearing of masks. The American take on masks has evolved over time, Hori says. The whole practice of face mask wearing started in the US during the Spanish flu pandemic in 1918, Hori says. But, interestingly, in the US, there was a strong public reaction against mask wearing. Many people thought it was against their civil liberty and they fought against it. So there was this cultural aspect that people didn't like being told what to do. But there are also issues of supply. In East Asia, people can buy masks in many places. The region has a well-developed infrastructure for producing and also distributing masks. This is not yet the case in the US, where mask shortages are commonplace at hospitals being hit hard by the epidemic. One of the reasons the CDC were concerned about the general public using masks was that they would siphon them off from the healthcare environment, where they already anticipated supply chain would be very tight, says Dr. William Schaffner, an infectious disease expert at Vanderbilt University. That was clearly part of what motivated the CDC in the beginning not to recommend masks for the general community. But now that it's clear that people can transmit the virus if they have mild symptoms or are symptom-free, Schaffner says that the calculus for recommending masks in the community has changed. With supply of genuine surgical masks and N95 respirators by and large being directed to the healthcare industry, experts recommend the public use cloth face coverings, but with one proviso: be realistic about their effectiveness. There are people in the US who will surely put on masks, or other facial coverings, and immediately now invite their friends in for a 3-hour poker party, and we're saying please don't do this, says Schaffner. These masks don't make you bulletproof. You have to add the masks on to social distancing and stay at home and maintain proper hand hygiene. Don't use them as a license to suddenly become very congregative. Don't go out in groups of people or invite them into your home. There's not a lot of strong scientific research into the widespread use of masks, and experts disagree on the role it could play in fighting the pandemic. There is no specific evidence to suggest that the wearing of masks by the mass population has any potential benefit, Dr. Mike Ryan, executive director of the WHO Health Emergencies Program, said at a media briefing last week in Geneva. But many argue that masks, while not perfect, provide at least some level of protection. Masks work, Sean So Lin and Robert Hecht of Yale University wrote in a commentary piece for the Boston Globe in March. There is widespread evidence from the field of occupational health, the SARS epidemic, and other outbreaks that wearing masks protects us from germs and interrupts the transmission of disease from sick to healthy people. Even if the scientific evidence to support the efficacy of the public wearing masks is still pretty thin, experts like Schaffner say that one certainty is that there is a psychological benefit to wearing masks. Without the mask, we're all sitting here as potential victims, waiting for the virus to find us, Schaffner says. By putting on a mask, it moves the locus of control to us. It may not be something important we can do, but it is something that each of us can do. It provides a sense that the individual is more actively resisting the virus. So even if the benefit is modest, I really think it's good for us.